Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Surgical wound classification based on the ACS NSOP. So under this, there is a clean. So there is clean under this. So what do you mean by clean? Clean means it is uninfected operative wounds. So it is uninfected. So uninfected operative OP wounds, operative wounds in which there is no inflammation. There is no inflammation, and no inflammation is encountered, and there is a respiratory ailment. So no inflammation is encountered. Then there comes a respiratory. There's a respiratory, alimentary, the genital, as well as the uninfected urinary tracts. So the uninfected urinary tracts, so they are not entered. So to recap, they are nothing but the uninfected operative wounds in which there is no inflammation which is encountered, and the respiratory, alimentary, genital, urinary tract infections, they are not entered. This is meant by clean. Then we move on to the clean and contaminated. So in terms of the clean and contaminated, they are nothing but the operative wounds. They are the operative wounds in which the respiratory, alimentary, the genital, as well as the urinary tract, they are entered. So they are entered, and this is under the controlled conditions. So they are entered under controlled conditions and without unusual contamination and without the unusual contamination. So they entered but without the unusual contamination. Next in line we have the contaminated type. So under the contaminated type, they are nothing but open. They are open, fresh, accidental. So they are open, fresh, and the accidental wounds, and their operations. So the operations are with major breaks. So the operations, they are with major breaks, and the instasterile techniques are used. So there is a presence of instasterile techniques. So the instasterile techniques are the gross spillage is seen, instasterile technique. Then the gross spillage is seen from the GIT, from the GIT, that is a gastrointestinal tract, and the incisions in which the acute non-purulent inflammation is encountered. And from the GIT and the incisions in which acute infections in which acute non-purulent inflammation is encountered. Next we move on to the dirty type. Here there is old traumatic wounds, old traumatic wounds. So they are with a retained devitalized, so retained devitalized tissue, and also the wounds, tissue and the wounds that involve the existing clinical infection. So they involve the existing, clinical infection. So existing clinical infection or the perforated viscera. To learn and grow daily like this, please do subscribe.